Hello, I'm Dr. Seth Green. I'm a clinical psychologist in APA Behavioral Health. So I'm going to run through a couple of the commonly asked questions. So let's get started. And the first one we have is, why is the registration packet for behavioral health a zillion pages long? A couple of the biggest reasons is that we need to make sure that we maintain compliance with HIPAA, which has to do with confidentiality and protecting one's private information. Also, we have quite a bit added for insurance and billing so that we can take care of that on our side of the house. And then in addition, we have accreditation, so we're accredited at a national level, and so there's some paperwork that goes with that. Also, the state requires that we have quite a bit of additional information regarding AK AIMS, which is a system that tracks how we gather information and how we input that information. And then last but certainly not least is what the services we have are and how they meet your needs. That is the reason the registration packet is so thick and why we have you work with registration and scheduling to email all of that back and forth so we don't have to kill a bunch of trees in order to do that. The next question we have is, how do I pay for services? Well, I have a couple of different options available. First of all, if you're IHS, then that's how services would be paid, and so there's no expense to you as the customer client. And then another option available to you is insurance. So if you have any insurance, then our registration scheduling staff and our billing department can help manage that for you. And then last, we do have a sliding fee scale for those under economic hardship or any particular reason that they couldn't pay. Anyone is welcome to apply for the sliding fee scale. And so that is how you can pay for services. And next, we have my cousin works at the front desk. Can they see my records or schedule me for an appointment? So the records themselves are actually sealed behind sort of a firewall. So when you bring up the medical record at large, behavioral health is sequestered behind a separate firewall for that. So if you're specifically talking about someone working at the front desk that does registration and scheduling, they can see your general information, but they can't see specific encounters. So if, for example, you saw your provider on a Tuesday and you're there on a Wednesday, the person working the front desk will not be able to read or see what the encounter says. However, they can schedule you for the appointment, but they can't see anything specific. Okay, I have been a patient forever. Why do I need an escort? We have behavioral health services here, but we're not a behavioral health services only building. Because we have so many different departments here and we serve so many different functions, and behavioral health is just a portion and a part of the larger scope of all the services. And we do escort people to and from behavioral health. And the aim is not a perspective or a belief that someone cannot escort themselves. That is definitely not the problem. It's more an issue of trying to make sure that we're doing a good job with taking you to and from the services that you're there for, rather than get diverted to all of the rest of the services that are available that are intriguing and people want to know it and they like the building and it's nice to walk around because of the historic artifacts that are in displays and the art that's present. So that's why we have an escort. I filled out the referral form. What is taking so long? I'm ready to schedule. This is a great question. So there is a referral management team that reviews every packet. And largely what's taking so long is, so you have a preference and all the different providers in the department have openings at certain times, and so getting those things to overlap and line up, that's really the hard part of why it takes so long sometimes to get into schedule. Two things that are important to know about that is APA does not have a wait list. Almost every single agency in town does have a wait list, but APA does not have a wait list. So we are actually getting people on the books and getting them scheduled fairly quickly. And then the second piece of that is that you submit your registration packet, it goes to referral management. Referral management reviews your referral, and a decision is made the same day. So what's taking so long in terms of the scheduling piece is just finding a time that the time you wish to meet and a time that we have a provider available. The next question we have is, why won't my loved one get help? And a big piece of that is you can't force anyone ultimately into services or care for behavioral health. It's not quite like you broke your leg, you need to go get seen by primary care and they're going to set your leg and help you out. There's a little bit more parts and pieces to it. So first of all, as behavioral health, we want to make sure we're really respecting autonomy, which is an important part of the values that we hold within behavioral health, but also fits the larger values of APA. In addition to that, desire for privacy and confidentiality is paramount, which means that your loved one may be getting help, but we can't disclose that, right? And so if you asked, we couldn't share whether or not they are or not. So it's kind of layered in those two pieces of making sure we're being culturally congruent with our values around autonomy and respecting that, and the idea that they may actually already be accessing care, and we just can't share that because we have to respect people's privacy and confidentiality, which is part of our ethical standards within behavioral health itself. All right. And then tied in, these two questions kind of go together. My auntie receives services at APA Behavioral Health. How are they doing? Are they attending their sessions? And if you ask us the question in the hallway, we have to sort of give a pat. We can neither confirm nor deny that your auntie's in services, right? And that's the reason that we phrase it that way is we're really trying to make sure that we're providing the standard of care that everyone would get no matter where they access behavioral health services from, which is to protect that privacy and confidentiality. However, if you want to know how your auntie's doing, your auntie could sign an ROI, which is a release of information, which would discuss how they are doing with you. And then in that way, and they said, hey, I want X to be able to speak with you and find out how I'm doing. Then we can have that conversation. Or at that point, you could also just have the conversation directly with your auntie. So is there a feedback or grievance form? There is both. So there is a link on the website for a grievance and a link for a feedback form. It's on the right side of the behavioral health pages, and the front desk staff can also provide a copy if you wish to come by in person. And it gathers contact info about your experience, the desired resolution, if applicable, where to submit that, and additional agencies and contact info with whom a grievance can be made. For example, you could submit the grievance to the state or to Joint Commission. Grievance and feedback forms are reviewed by committee, and then recommendations for resolution are shared with the department director. And of course, that's very limited in terms of protecting the confidentiality piece and privacy that we've been talking about earlier. And there is a client satisfaction survey that's available via a QR code, which is located in the behavioral health lobby. My regular therapist is not available. Is there someone else I can talk to today? And the answer to that question is absolutely. So Monday through Thursday, we do have what's called a RAS appointment available, which is a Ready Access Services appointment. And it's basically a sort of a drop-in, walk-in type appointment available. So if your therapist is going to be out for an extended period of time, we can also set up another provider for you to meet with on a regular basis, but that'd be coordinated between your existing provider and a provider in the clinic. Also, the Ready Access Services appointments can be used for staff who are having a tough time and just need someone to talk to for an acute issue or a situation. And if you're out in the region, then we have Ready Access Services available to get seen the same day and make sure that the continuity of care is being provided when you're out in the region. So a little bit different between Anchorage-based for the RAS services and then the regional-based. So last question we have today is, can I bring my child to my appointment? And yes, you can as a one-off. Sitter didn't work out, something happened, right? You need to bring them with you. So yes, as a one-off, you can certainly bring your child to an appointment. If you're asking the question in a different way, can I bring my child to an appointment because you're wanting services for them? I would plug getting your child into services. We can definitely do that. And finally, if there's a need or desire for family therapy, you can also access those services at APA because we also provide family therapy. And that can be a conversation you can have with your provider about, is family therapy a good option for me to bring my child to? And then if it's something that's of an ongoing nature and you consistently need that, then that's more of a longer conversation to have with your provider directly. If you have any questions about anything that's popped up in the frequently asked questions, please reach out to any of the behavioral health staff. The registration and scheduling at the front desk are always available during business hours to answer any questions immediately, and a clinician can get back to you same day. So if there's something you want to know, please reach out. We love to talk and share what we do, our services, and how we can be of help.